l'équipe de la présidence prévoit à chaque fois des communications à la fin pour dire voilà de quoi on a parlé, etc. Donc comme je disais, c'est un tout petit peu difficile pour nous de nous prononcer avec force sur certains sujets, parce que c'est pas notre place dans l'événement aujourd'hui.
Le programme d'aujourd'hui c'est DOORSTEPS.
Pour la presse, il y a DOORSTEPS et puis il y a l'installation à la table. Vous pouvez assister aussi ou bien ce sera filmé, je pense.
Voilà.
Et après il faut que la presse sorte. Voilà. C'est vrai que c'est l'idéal de poser quelques questions maintenant, même si à mon avis ce sera très général. Et du coup demain, ce qu'on disait, donc il y a une conférence de presse mais qui est vraiment focus sur la prise de médecine à la hausse. Qui est conférence de presse, elle est que sur elle est sur il n'y a pas sur les résultats de l'informel. Non, donc a priori pas. Oui, mais parce que justement, donc, la médecine, c'est vraiment quelque chose sur lequel on peut beaucoup plus amener de news et se positionner, etc. Et c'était un truc super important qui nous a aussi été posé beaucoup comme question en Belgique. Ça a vraiment fait énormément de bruit. Et donc, on nous pose la question depuis des mois. On a des médecins en avant parce que ça paraît loin, et en même temps, ça a un impact tellement évident et réel sur les citoyens. On espère que ça puisse intéresser, parce que c'est vrai que la présidence, c'est jamais pourquoi, several times, but it's very difficult to create sufficient attention for what's happening with the Belgian presidency because it seems like it's far from the people, so journalists are often not coming. Here it's a huge event and we don't see much. There's also just plenary of the mandate. Like another. But yeah. So that's also why we chose to focus the press conference on one topic that's very concrete, that had raised many questions, and create some attention here, especially with the coming elections. People need to understand why Europe is important. Donc, voilà. Et donc c'est pour le journal du médecin et le soir
Je travaille pour le soir, mais là je vais pour le journal du médecin. Je sais pas si elle s'est fait.
Elle m'a rien dit, donc je pense pas. En général, elle me prévient.
En général, parfois je peux faire du coup un truc pour eux aussi, mais ils m'ont pas demandé du coup.
N'hésite pas.
Il y a un communiqué de presse qui est parti ou qui arrive
qui arrive et qui viendra de la présidence.
Ouais,
ça va. Et jeudi, rien à voir, mais on a un autre événement sur le Nutri-Score.
Ah ouais.
Et ça, c'est super intéressant.
Ah oui.
Yeah, also interesting for you. So that's with the Queen. Ah yeah, no.
Hi. Hi, Catherine. Yeah, no worries. I was cycling hard to get here. Yeah.
Perfect.
Yeah.
I was just saying that maybe more precise questions on his so I can tell him to be prepared to give more people confidence because he's going to be, I think, quite strong.
Yeah.
So if you have a topic that's
Tell you or too late?
I can tell you.
at this informal meeting of the health ministers, we will discuss, first of all, the challenges for our health workforce. Our health workforce has tackled one of the most severest crises in public health in recent history. And so many people in the workforce are still tired. This has been very tough, and we should, first of all, be very grateful towards them. However, next to the aftermath of the COVID-19 crisis, there are some fundamental trends that are very challenging. There is the aging of the population, which means more needs for care and healthcare, but also aging, obviously, within the workforce. There is new technologies, there is new complexities. And so one of the questions that is really confronting all the ministers is about shortages, about the kind of organization of the workforce we need for the future, the kind of skills, the skill mix, and how new technology can create new opportunities to make the work more interesting and more durable to sustain. The EU is an interesting forum to discuss those very common challenges, but there is more to it. The EU has also a very important role to play. You think about the Professional Qualifications Directive, which is about titles for people in the workforce and how these titles allow them to be mobile across Europe. The question is whether this framework is up to the challenges of tomorrow. That's what we will discuss. COVID-19 has shown us that working together, organizing real solidarity at EU level has enormous added value, but also thinking together about the challenges for the workforce, exchanging ideas, can be a real added value. That's what we will do today. But we do this thinking about our workforce, the doctors, the nurses, the physiotherapists, all those involved, being grateful for what they do, for their commitment, their daily work, trying to improve the context in which they can continue that work. Thank you.
Minister, is there support for an EU comprehensive strategy on this among ministers?
But the word strategy has a relatively precise meaning, so I think there is a real support to have a discussion, an exchange, and to develop a common approach. There are issues where the EU has real bite. You think about Professional Qualifications Directive, that's a legal framework where the EU is a key player, and there obviously we have to think about the future evolution of that framework and how that framework impacts upon our policies in the member states. There you have a legal framework. In general, I think what we need is to learn from each other on the best kind of approach that is needed.
Minister, on the pharmaceutical strategy, I would like to ask, what do you think, will countries lean towards the Parliament's proposal to extend RDP?
That is absolutely premature for me to answer such a question at this moment. Obviously, we are discussing it, we are looking into it. As you know, we first started a discussion on the aspect of shortages, also because the pharmaceutical legislation is important in that respect, but also that seemed to us most urgent. So there's an ongoing discussion with the Parliament and Member States. The first issues we wanted to discuss were shortages. Next, we discuss, obviously, all the other issues, but it's premature for me to give any personal opinion on that.
But do you think countries will lean towards more industry or patients' access? I know that it's about balance.
That's a question for a political scientist.
Merci beaucoup pour l'invitation pour cette conférence. Merci, je suis ravie d'être là. Merci.
He's not gonna comment on pharma. No. Yeah. But neither, like, sorry. Yeah. Yeah. Yeah, I think it's also interesting to see how the health workforce plan will go and what's going to happen with it. Yeah, so, okay, perfect. So for the follow-ups, yeah. Okay. Okay, cool. Nice. No, I don't think we spoke. No, that's true. Yeah. Yeah, but I joined like 2 months ago the team, so I think that's why we came across. Yeah.
Whenever. It is an honor for me to be here representing my country, Malta. These fora are extremely important. We're going to discuss health, which is a top priority of all European citizens. We're going to discuss human resources. We're going to discuss critical medicines. These are very important, and especially for small countries, we need to make sure that we are not left exposed and that we are not left lacking. Thank you.
What's the main healthcare challenge for your workforce?
The important thing about the workforce is to recruit, but more importantly, to retain. And movements of persons within the European Union is obviously a good thing, but again, I stress the importance that small countries especially do not bear the brunt of movements outside of our countries. It is important that we have a workforce that is educated and skilled, and governments needs to come together in order to make sure that retention of the workforce is paramount.
And what can be done at an EU level to assist with this?
I think since the European Union is a single market, is a single region as it were, we need to make sure that the framework for educating and skilling our workforce is a holistic one. What applies in Malta should apply in other countries.
Minister, for pharmaceutical package, what will be the main aspects that you want to ensure that will be in there for your country?
Again, my country is a small country. Being small has advantages, but disadvantages as well. And what I said earlier, it is important for small countries not to be exposed, not to be disadvantaged. When it comes to access the markets, this is paramount. And again, in a single market, I don't see why we should bear the brunt of shortages anywhere. So forums such as this one are extremely important because we can talk together, we can discuss together, but then we need to come to decisions and conclusions.
Would you like to see more joint procurement, more medicines?
I would. I think for a small country, joint procurement is paramount. There are several other options that may help smaller countries, for example, price transparency. I think for the European Union as a whole, what we can work more upon is the production of APIs. The production of APIs has dramatically moved out of the European region to China and India. In a way, that's good because prices have come down, but that has left the European Union exposed without facilities that can make these APIs. I think we can incentivize companies to bring them back to the European Union in order to have more capacity for APIs in the Union itself. I think that will go a long way to secure supplies in Europe. God forbid if another tragedy like the COVID pandemic had to befall us.
Is incentivizing good way with years, RDP years?
I'm sorry, I didn't get that.
RDP years, extension of the protection, data protection in the holistical strategies? You think it's a good way?
Well, that is a good way. What I was talking about was in terms of providing companies that produce APIs with a lot of incentives, like tax-free zones. For example, subsidizing electricity, subsidizing water facilities for these important companies. There's a lot that we can do, but that will come out of discussions and fora like this one. Thank you.
Hello. I'm really glad that we are able to have a meeting at this level in Brussels today. We will address three major topics. First of all, and I'm really looking to see or hear the discussion of the ministers in this area, is the health workforce and the issues connected with this. Currently, most of European countries are facing the issue of aging and the aging of population, which translates directly to the health workforce. And we're looking forward to creating a common EU strategy tackling the issues with health workforce. That's basically the first issue that we are going to discuss. Secondly, I'm really looking to see the ideas and discussions that we'll have in terms of non-communicable diseases, especially in the area of primary care. And we see that the EU has several tools with which they tackle those issues, like the European Beating Cancer Plan or the comprehensive approach to mental health, which are the major tools that we see, and we'd like to take as examples to get to tackle the NCDs in the future. And the major topic, the third one, is basically the safety of medical supply, which is an issue that we are facing, especially in Slovakia, and we're really looking to open the medical alliance that will be going live tomorrow, and we are hoping that this will be the main tool how to address the supply chain management and transparency of the supply chain management, and to be able to keep everything on track.
So tomorrow we'll be discussing further steps to ensure the security of medicines. Where do you think the EU action in that value? Is it in terms of financing, as well revision of the state rules? Is it more to resort to more joint procurement?
Well, I'm really looking towards several areas. Joint procurement is really interesting, and we'll see how the other states are reacting to this topic. I'm looking also I will see if we're going to have discussions aiming also to common or joint health technology assessment, for instance, in terms of medical usage and the influx of medicine. And one major issue that we will have to discuss is the budgetary impact that new medicines and new innovations have towards every system in the EU.
You will also be discussing the health workforce. What are the main challenges that the health workforce is facing in your country, and how can the EU help?
Well, the main issues, as you know, are common for all the countries in the EU, and that's the lack of basically the health workforce. So currently in Slovakia, we see that also due to the demographics, the population, also the health workforce, as it is getting old. It's aging, and we have a hole and a gap in the education levels from younger physicians to older physicians. The same thing in nurses. So we have to discuss several topics in how to fill the gap between once we get the new physicians to the system, and we're looking to new competencies, new level of new approaches, telemedicine, for instance. And we hope that if we create a common strategy on the EU level, that will really help us to get the directives and regulations in place. Thank you very much.
Ready? Good morning, everyone. Today with the health ministers, we have on the agenda many of the important pillars of the European Health Union that we are building to discuss. Importantly, we are discussing Europe's Beating Cancer Plan with a focus on prevention of non-communicable diseases, and we're also discussing the issue of staff workforce shortages in the European Health Union. The issue of access to medicines and medicine shortages is central to the European Health Union. Every patient should have the right to have access to medicines they need, no matter where they live. And we are tomorrow launching, together with the Belgian minister, the Critical Medicines Alliance, where we will be able to bring together the industrial pillar of the European Health Union, bringing together industry, civil society, stakeholders and member states to really be able to see the issue of shortages in a different light. Because ultimately, this is what the European Health Union is about, and what we are discussing, what we are working on, is the European Health Union in action. Thank you.
Έχουμε μία πολύ σημαντική συνάντηση στις Βρυξέλλες αυτές τις 3 μέρες. Πρώτον, έχουμε να συζητήσουμε τις μεγάλες ελλείψεις υγειονομικού προσωπικού. Κάτι που εμφανίζεται πια σε όλα τα κράτη-μέλη της Ευρωπαϊκής Ένωσης. Χρειάζεται να το αντιμετωπίσουμε μαζί, να βρούμε τρόπους ευέλικτους για την προσέλκυση περισσότερου εργατικού δυναμικού σε αυτούς τους τομείς, πάντοτε όμως, το τονίζω, σε συνεργασία με τις οικίες επαγγελματικές ενώσεις. Αυτή θα είναι και η θέση της Ελλάδος, ότι κάθε αλλαγή θα πρέπει προηγουμένως να έχει περάσει από εξαντλητικό διάλογο με τις οικίες επαγγελματικές ενώσεις. Παράλληλα, ήδη η Ελλάδα πριν από μερικά χρόνια είχε θέσει το θέμα της ελλείψεως των φαρμάκων. Είναι ένα θέμα το οποίο το αντιμετωπίζουν επίσης τις ευρωπαϊκές χώρες και ξεκινήσει μια πολύ μεγάλη συζήτηση πια στην Ευρώπη για το πώς τα κράτη-μέλη θα μπορούν να βρουν τρόπους αντιμετωπίσεως της ελλείψεως των φαρμάκων που αντιμετωπίζουν σε διάφορα είδη, αντιβιωτικά, ινσουλίνες, αλλά και διάφορα άλλα είδη φαρμάκων. Νομίζω ότι η κοινή μας δράση θα αποτελέσει το κλειδί για να παρέχουμε καλύτερες υπηρεσίες υγείας και περισσότερη κάλυψη του πληθυσμού σε φάρμακα σε όλη την Ευρωπαϊκή Ένωση. Και βεβαίως θα είμαι εδώ για να συνυπογράψω με άλλες ευρωπαϊκές χώρες το μανιφέστο για την κοινή δράση, το κοινό μεγάλο έργο ευρωπαϊκής σημασίας που είχα ήδη εισηγηθεί ως Υπουργός Ανάπτυξης στο παρελθόν, για τη δημιουργία παραγωγής πρώτων υλών και γενικά φαρμάκων μέσα στο ευρωπαϊκό έδαφος. Η Ευρώπη την εποχή της πανδημίας κατάλαβε ότι μπορεί να μείνει εύκολα χωρίς φάρμακα. Αυτή την έλλειψη, αυτή τη φοβία δεν πρέπει να ξαναζήσουμε. Με το μανιφέστο που θα υπογράψουμε και στο οποίο μανιφέστο η Ελλάδα είναι ένα από τα κράτη που πρωταγωνιστούμε, θα μπορέσουμε να προσελκύσουμε με κατάλληλα κίνητρα μεγάλες βιομηχανίες για παραγωγή φαρμάκων στο ευρωπαϊκό έδαφος και πρώτων υλών στο ευρωπαϊκό έδαφος. Yes, Greece supports joint procurement as a key for the sustainability of pharmaceutical supply. Pandemic and how we deal with the vaccines at that period proved that we can do it all together in a much more sufficient way. And of course, we have to give the right motives in order to have a European production of this kind of medicines. As the other European nations also have a problem with doctors, anesthesiologists the most, and have a problem with nurses. And this is the discussion we have to do with my colleagues.
What do you expect to be done at an European level to address the workforce problem?
We have to find a more flexible framework in order to attract more people in this kind of services and professions, but as I said before, without jeopardizing the quality of service. Τώρα πάω από εδώ,
Hola, ¿qué tal? ¿Cómo estáis? ¿Qué tal? ¿Cómo estáis? ¿Llegas? ¿Me acerco? ¿Así? ¿Me puedo acercar? Ok, bueno. Bueno, pues nada, buenos días. Hoy estoy encantada de estar aquí en esta reunión informal de ministros de Sanidad en el contexto de la EPSCO durante la presidencia belga. Y bueno, pues vamos a tratar temas que creo que son de gran importancia también para España, ¿no? Como pueden ser los problemas que estamos teniendo dentro de todos los Estados miembros con los profesionales sanitarios, cómo podemos hacer también un abordaje hacia la prevención del cáncer de manera más unificada y, como no, también la estrategia sobre los medicamentos, ¿no? Sobre esos medicamentos críticos, como desde la Unión Europea pues podemos hacer una estrategia conjunta, y mañana tenemos esa reunión importante de la Alianza sobre los medicamentos críticos. Bueno, igual que otros años anteriores, ¿no? Todas esas plazas que están empezando a ser ya de difícil cobertura, ¿no? Como pueden ser las plazas de atención primaria, lo que vamos a hacer es una segunda vuelta de una convocatoria extraordinaria para intentar que efectivamente que no quede ninguna plaza vacante, ¿no? Pero yo creo que la reflexión tiene que ser también un poquito más amplia sobre por qué nos están quedando plazas vacantes en algunas de las especialidades que para ahora mismo son nucleares, pero que llevan arrastrando desde hace muchos años problemas en su cobertura, pues por las condiciones de trabajo, por las dificultades a la hora de ejercer la medicina tal y como la estudiamos. Y bueno, por eso desde el Ministerio hemos creado una comisión específica, en este caso de atención primaria, para poder abordar todos aquellos problemas que hacen pues que algunas plazas se queden vacantes y que algunos residentes, nada más empezar su especialidad, pues abandonen las plazas, sí. Bueno, nosotros desde el Ministerio siempre estamos incidiendo en que las condiciones laborales, no solo las económicas, son una de las cosas que tenemos que abordar, ¿no? Más allá de los incentivos económicos hay otros muchos incentivos, como puede ser trabajar bien, ¿no? No tener 60 pacientes al día, no tener 6-7 guardias al mes, intentar reducir las horas de guardia, hacer el trabajo, apoyar el valor que tiene el trabajo dentro de las profesiones sanitarias, ¿no? Entonces esto tenemos que abordarlo, insisto, desde un marco más amplio, y nosotros estamos reelaborando el Estatuto Marco, que está obsoleto desde el año 2003, y que tenemos que hablar de todas las condiciones laborales, ¿no? No solamente de las económicas, sino del resto de condiciones laborales que hagan que sea atractivo y que podamos retener el talento que hemos formado.
Hoy que se tramita la ley, ¿maneja algunos plazos, algún calendario? ¿Cuándo podría entrar en vigor?
No manejo ningunos plazos, ya esto está en el Poder Legislativo y obviamente bueno, pues queremos que al final salga una ley que sea una ley integral, no solamente para Lela, sino también para el resto de enfermedades neurodegenerativas, y bueno, pues que al final dé soporte y dé cobertura a todas las necesidades de todos los pacientes con enfermedades neurodegenerativas y con ELA.
¿Pero confía en que la gente tenga apoyos parlamentarios para tramitarlo?
Sí, yo ya esto lo dejo en manos de los grupos parlamentarios y de, bueno, pues de las aportaciones que a través de las enmiendas parciales se puedan ir haciendo. Hay varios textos, ¿no?, que están concurriendo y que al final, pues insisto, ¿no?, desde el Ministerio de Sanidad nosotros vamos a poner hincapié en todo el tema de la investigación, de la rehabilitación y en todo el tema también del soporte social, ¿no?, que necesitan estos pacientes, más allá del soporte médico, del soporte clínico. Pues muchas gracias.
Trabajadores sanitarios es algo que se va a discutir también estos días. ¿Qué se puede hacer? Ha hablado usted de unos cuantos planes para plazas de COVID. ¿Qué se puede hacer a nivel europeo para ayudar a España o a los países?
Bueno, pues a nivel europeo se puede hacer básicamente un buen diagnóstico, ¿no?, de qué es lo que estamos haciendo con nuestros profesionales, cuáles son las maneras de motivar el conocimiento y de retener el talento. Y como al final las estrategias y las políticas muchas veces en Europa son comunes, pues yo creo que lo primero que tenemos que hacer es un diagnóstico, ¿no?, de hacia dónde vamos, qué queremos que sean nuestros profesionales y también aprender unos de otros, ¿no?, hacer ese benchmarking que tanto nos gusta hacer de qué es lo que se está haciendo en otros países para que funcione esa retención de talento, ¿no? Nosotros hemos puesto encima de la mesa, por ejemplo, el tema de las guardias de 24 horas, ¿no?, que creemos que es algo anacrónico y obsoleto. Bueno, pues ya hay países en la Unión Europea que han prescindido de estas jornadas y bueno, pues aprendamos de ellos y en cambio yo creo que desde España tenemos muchas cosas que enseñar también porque tenemos un sistema nacional de salud muy robusto con una atención primaria que aunque ahora está debilitada pero es uno de los ejes fundamentales y bueno, podemos también de alguna manera mostrar nuestras grandes fortalezas y aprender también para reducir nuestras debilidades. Muchas gracias.
Added value would be like, is it in terms of joint procurement, revising state aid rules?
Okay, Spain have we will make support for the political strategies for have a supply chain, no, all the supply chains in Europe, no, and we have to support all the policies that can achieve this strategy, this political of medical systems and medical things. Thank you very much.
Okay, so can I start? So for the Czech delegation and for Czech Ministry of Health, is one of the key topics which we would like to highlight. It is the, let's say, the focus on the, integration of different legislation which are coming to the area of healthcare. As you know, we have a number of strategies in to set up, the safe environment for the future production of pharmaceuticals. But unfortunately, sometimes, there are a number of other legislative movements and directives which are also affecting, this sector. And very often, we are not able to really maintain it. So I would like to highlight it, for example, the wastewater treatment directive, or currently we are discussing in national parliaments the critical infrastructure directive. And all of them affecting the way how the industry is running their operation in Europe. And sometimes, we are not really considering the impact of those pieces of legislations which are not directly healthcare, but they have a big impact on how the pharmaceutical industry and the production look like in Europe. So it will be probably one of our key focus today and tomorrow, and it's closely connected to the availability of drugs in Europe for the future. Yep, thank you very much.
I know it's about balance, but in the end, there is no perfect balance. So what is essential?
Yeah. We are always talking about the access of innovation, but recently we have much, more difficult time with, quite old pharmaceuticals, generic pharmaceuticals, and unfortunately, we are not really making the steps, to have, support, for this kind of production in Europe. And as I mentioned it, even at the moment, we are ready to support it also financially. There are a number of limitations, de minimis support, which you have to always follow. But very often, when you see a really low-cost pharmaceuticals, if you want to launch a new production, it's really impossible because the time which is necessary for return and for some profit for the industry in this field without the public support and keeping this production in Europe is nearly impossible. So we have to really talk how to set up the conditions to keep this part of production in our member states, and how to find the public support which could really help to secure this kind of production and supplies for our patient. And I mentioned it, for example, this wastewater directive. And yes, it's definitely a good idea to have the push to the industry to take the responsibility for pollution and all those things. But at the same time, if you take the pharmaceuticals, where the pollutant is the active substance, it's very difficult to remove it from the treatment. At the same time, they have to pay, for the clearing of the water and so on. And if we take how low is the price of those medicines, it will really require quite a lot of attention to ensure that this will not make another, push to close the production and leave it from Europe. The same it is, I mentioned, the critical infrastructure directive. Again, there is a lot of requirement for the producers to if they become the critical infrastructure, to keep it, all those requirements and to run, the internal operation to maintain, everything what we ask for them. At the same time, we have not subsidies, to ensure, it will not affect, the sustainability of the production. So all those things we have to really take it in consideration when we are, introducing the new legislation in Europe. And sometimes we are introducing, the laws and directives which are really meaning well to support the environment, the health of the people. Unfortunately, sometimes let's make the production not anymore sustainable in Europe. So, we would definitely like to have more, strategic approach, to how we are introducing the directives and regulations, affecting the industry, to ensure that still the patients, has the treatment they need. At the same time, what I don't like it is that very often that push, to have, the more regulation in this field, it creates the cost. But unfortunately, that cost is coming, from the pockets of the patients. So the most vulnerable group, in our society. So once we're introducing the new regulatory issues, doesn't matter in which field, we have to ensure it will not mean the additional cost, for health insurance and for the patients. I think, what we have to ensure, that every piece of legislation which comes, from the European Parliament and from the European Commission ensures that there is a real impact assessment, which will say, what will that means, for the patient and for the health insurance. We are doing that regularly in the laws and in the directives, which are directly from the healthcare sector. Unfortunately, not always we are considering this impact, in the regulations and directives coming from different fields, like from the industry and regulation, and for example, from the environment. So this is, let's say, something, what we would like to push it more, that we are really doing this real impact assessment with, let's say, focus, what does it mean, for our patient, out-of-pocket payments, but also for the health insurance.
Data protection as an incentive used in the pharmaceutical strategy and baseline is 6 years for the Commission. Parliament extended it. Do you think Council will extend it as well, or stick with the Commission's proposal?
I think, we have to stick with the proposal. I mean, another extension means, every extension means, we are, let's say, moving, from this pool of data which are available, not just for the patient, but also, for us, for the ministries, to ensure the planning and proper strategies, to set up, let's say, the development of our healthcare system. For Czech Republic, which is definitely not the number one in the quality of the care, but I think still, the average in Europe. It's always good to have the comparison, to have a data which will allow us to ensure that the steps which we are introducing are really, giving the better results, for the care, and moving towards, the rest of the Europe, with the quality of care. So for us, the data which we will need it, and I believe, this European Health Data Space implementation is absolutely necessary for us to do the proper planning. And even if you take, for example, the projects like European Beating Cancer Plan, to be able to evaluate that the investment and also the implementation of this project, really, give us some results, we will need those data. And we are pushing for a number of other strategies, like for rare disease, but also for the cardiovascular area. We would like to have something similar as for the cancer. But at the same time, we have to have enough data to evaluate that the European Beating Cancer Plan really give us the results, and it helps the equal access of patients in Europe. Welcome. Thank you very much.
I would first like to thank the Belgian government that presides the Council of the European Union for organizing this informal meeting of the health ministers of the European Union. We'll be given this opportunity to discuss ways to tackle the health workforce crisis, to discuss the important medicine security of supply in the European Union, and also to discuss the European Union's plan with respect to fighting cancer. I'm also pleased to be given the opportunity to attend the launch ceremony of the Critical Medicine Alliance, where we'll also be given the opportunity to discuss ways to strengthen the European Union's ability to maintain availability of critical medicine within the Union. It is an extremely important matter for small countries like us, like Cyprus, as due to our size, we're not as attractive to the pharmaceutical industry. Yes. Well, with respect to the lack of workforce in Cyprus, it's mostly around nurses and generally primary care. We believe that ways to tackle this issue is to assist even with funding with respect to training programs, scholarships, especially where we have a lack of health professionals, and also assist with respect to the to retention mechanisms as far as the health professionals are concerned, as it is vital for those that work in the industry to feel happy and have job satisfaction with respect to being maintained within the industry. Thank you.
My name is Akko Ankeba-Johansson. I'm a Minister for Healthcare from Sweden, and I really look forward to this informal EPSCO meeting. especially because we are about to talk on pharmaceuticals. Nearly every country is facing shortages on pharmaceuticals, and so is also Sweden. Therefore, it's important that we discuss together what we could do in the EU level, even if I know a lot of things need to be done at the member state level. We need to do more in Sweden. But it is a question also that is mentioned in the new pharma package, the proposal from the European Commission, and the Swedish government is supporting the overall aim and the intentions from the Commission on the pharma package. But there are questions where we are worried, and that is on data protection, because we need to be competitive in Europe. Companies need to invest in Europe so we can get the best drugs for our patients. And if we shorten the time for data protection, I am worried that we will be less attractive. So from Swedish point of view, we need to maintain the current regime, maintain today's regulation on data protection, because it's important for our patients and also for Europe's competitiveness. So that will be an important question for me tomorrow when I have a special meeting together with my Danish colleague, Sophie Löde, and other countries in order to discuss this question. So I look forward to this meeting. For the Belgian presidency to host this meeting, and of course the questions that we will discuss together on pharmaceuticals. Thank you.
Minister,
next one.
Minister, what do you think the main benefit of this Critical Medicines Alliance will be? How will it make a concrete change to the situation in Sweden?
Maybe not in Sweden, but maybe together on the EU level it will make a difference, of course, for preparedness, both for patients today and preparedness at large. That will be important.
For the data protection years, as you mentioned in the introduction, what should be the baseline then that Sweden would advise to take? Because from the Commission's point, it was 6 years.
Yeah.
If Parliament increased it, do you think Council will increase or should increase more?
I think we should maintain the current regime. It is important, yes, 8 years, and the predictable regulation also, both the years, 8 years, but also be predictable, because in the Commission's proposal there are some things that make it less predictable, and that is not good for investments. And I think this is or has become a key issue for medical pharmacy companies, and we need to address that one. And if we don't, I think shortages will increase, and I will fight against that.
Less predictable, could you elaborate more on that? Which aspects make it unpredictable for the pharma?
I think we are negotiating those questions, and I will come back to that and not comment them more today. But you have a clear message from the Swedish government. We don't have to maintain current regime on data protection.
To ensure security of supply and innovation, the EU should also revise its state aid rules and the rules for public procurement of medicines, for instance.
That is a question we will discuss tomorrow and listen to each other. I don't think procurement is the overall solution for things, but could be used from one time to another. But I think we need to discuss this, the whole area of regulation on pharmaceuticals and also on medical devices, because they're connected. So it's important questions that we will have to discuss today and tomorrow at this informal meeting, but also on the next more formal EPSCO meeting.
Would you support more joint procurement at an EU level?
I don't think that it will be the regular way to work, but in some ways, sometimes maybe we should use it. It was good during the pandemic, but I think it is one of a lot of tools that we can use.
What are the other tools?
What do you say?
What are the other tools?
That is a better regulation, and I'm glad for the proposal from the Commission. The overall aim is very good, but we need to look at this question on data protection, because that's an important question. Thank you so much.
Thank you.
So I'm very happy to be here from the Norwegian delegation. And I want to thank you to the Belgian presidency for bringing all these important issues to our agenda, especially when it comes to the health workforce, which is very important for us in Norway as well. So we're happy to contribute to all the important issues, and I'm looking forward to good discussions. Thank you.
Are there any lessons we can learn from
I think we have a lot to learn from each other on all these issues, especially when it comes to the pharmaceutical industry as well, how we cooperate, and also how we actually work to differentiate tasks when it comes to the health workforce, and also how we actually are putting forward the joint action on the prevention, because the NCG agenda is very important for us as well. Thank you.
So good afternoon, I'm Hans Kluge, the Regional Director of the World Health Organization for Europe. I would like to congratulate Deputy Prime Minister Frank van den Broeke and the Belgian EU presidency for putting health workforce that high on the agenda. Very clearly, the whole region has a health workforce crisis. In 13 countries in Europe, more than 40% of the medical doctors are 55 years or older. It's also a gender equality crisis. Women make up 75% of the health workforce, but only occupy maximum 30% of leadership positions, and there's still a 24% of salary gap compared with the men. So WHO is very keen to work close together with the European Union, and the top priority is to retain and reactivate the healthcare workers who have done an amazing job. Second, yesterday the World Health Organization has activated the European Union Civil Protection Mechanism that would allow European Union countries to help medically evacuating up to 9,000 patients from Gaza, including 1,500 with cancer, 4,000 with heavily injuries, and 500 patients from Gaza in urgent need for hemodialysis. Thank you. Well, first and foremost, we should listen to the voices and the aspirations of the people themselves, meaning the doctors, the nurses, the informal carers, and of course ensure good working conditions. Because what we see is there are less and less young people in the profession, and they're highly skilled, so they can easily go to other sectors for the professions. And second, to take care of their mental health. During the COVID-19, 1 out of 3 health workers had a burnout. And we know that good mental health for the workforce is good for everyone.
Mr. Kluge, one question. How do you think countries should work around ethical hiring recruitment and that one country wouldn't steal professionals?
This is a very big issue. Actually, I was here at the European Union, African Union Summit not so long ago, and Deputy Prime Minister van den Broeke made it very clear that this should not be a win-lose situation. This year, the World Health Organization is reviewing the WHO Global Code on the ethical recruitment of health workforce. And of course, it needs to follow these ethical principles, not only for the countries which are seeing their workforce going, but also when doctors and nurses arrive in a destination country, that they don't end up like a taxi driver or a shopkeeper. So there has to be very clearly an agreement between the countries through strengthening WHO Global Code.
Do you think in this proposal Belgians will manage to have it?
I think so. I'm very confident. I mean, health workforce has been a top priority of the Belgian EU presidency, and what particularly pleases us, WHO, is when I spoke to Prime Minister De Croo in Mons lately, that health and universal health coverage is a priority not only for the health sector, but for the whole government. And this is what happened, because we're very nervous that we see that health budgets are being slashed already. You know, we're just coming out of the COVID-19. We saw that without health, there is nothing, and already health is disappearing from national, regional, global agendas. Look at the EU for Health, slashed €1 billion, €2 billion from Horizon 2030. So we should know, if there's a person who is healthy, he or she wants everything. But if a person is sick, he or she wants only one thing in life, and it's strong health. Thank you.